Well, it is no secret many of us have put off yearly checkups and other medical treatments due to the pandemic. But it's time to make an appointment for screenings. We know early detection can save lives. Here with more insight is today's ciHealth sponsor, Carle. And we're so happy to have Hannah Dignan, advanced practice registered nurse, and Dr. Stephanie Schroeder joining me now. Hi guys, thanks so much for being here.
Yes, thank you for having us.
All right, so I want to start things off by talking about mammograms, because they are so important for detecting breast cancer early. So, Hannah, tell me about what age women should begin scheduling those mammograms.
Great question. So the American Cancer Society recommends starting mammograms at the age of 40. So these are for women who do not have a family history of breast cancer or do not have any symptoms. However, I will put a caveat on there. If you have a family history of breast cancer, ask your provider whether you should be starting your screenings any bit earlier. Additionally, if there are any self-detected abnormalities in the breast, you should also be asking your provider whether or not it would be of benefit to you to get diagnostic screening.
Okay, and let's say something abnormal is detected. How can Carle best help patients who are facing a diagnosis?
Great question. So we have a comprehensive medical team at Carle in the breast center. So we have medical oncology, surgical oncology, radiation oncology, state-of-the-art imaging, and all access to clinical trials, 3D, 2D mammograms. So it's really a comprehensive cancer center there if there is cancer that is detected.
Okay, Stephanie, let's move on. We're kind of encompassing the whole family here. So let's talk about our children. Let's talk about children's screenings, and specifically, what ages are some key times to get your kids in to be seen?
So we really like to see them when they're preschool age and kindergarten. Right before they're ready to go into kindergarten, we're going to screen their hearing and talk to families about other things that they need to do as far as going into school, such as seeing the optometrist and seeing the dentist.
Okay, and there are some vaccines that are typically taken care of then.
Yes, there are.
What are they?
So usually at that age, they're going to get their second measles, mumps, rubella, and chickenpox, and a diphtheria, pertussis, tetanus, polio.
Okay, and then sixth grade is the other big age.
That is.
What happens in sixth grade?
So in sixth grade, again, we need to see them for that physical, and they're going to get another round of shots that year. So they're going to get another tetanus shot, meningitis. They're going to get their first HPV as well.
Okay, I did see that a good tip is to not necessarily promise your kids that they won't get a shot when they go in for those screenings. Why is that so important?
So there are some times when you may fall a little bit behind, especially with everything that happened with COVID. So you don't want to promise that they're not going to get shots because they may end up needing one or two to get caught up with their peers.
What kinds of questions are typically asked in those screenings?
Usually in a physical, I try to run the whole gamut of what we need to know. So what grade are they in school? How did school go? Are they being bullied? How are they sleeping? How are they eating? Have they seen the dentist? They get their hearing and their vision checked, and for kids 12 and up, we do a depression screening as well.
Wow, it even comes down to like, is your kid riding a bicycle? Are they wearing a helmet? I
Yes,
assume.
I like to be a big stickler on safety, so I like to ask if they're wearing seat belts. If they have a bicycle they ride, making sure they're wearing a helmet. I like to ask, and the big safety question that I ask is if there's a gun in the home, you want to make sure that it's locked up safely.
Gotcha. Let's talk COVID-19 vaccine. What are you guys recommending for kids as they return to school this year?
So age 12 and up are eligible for the vaccine, and we can do that for them in clinic. You can also find other places on the carle.org website to get it done. And we are still encouraging all children ages 2 and up to wear a mask when they go back to daycare and school.
Okay, and we want to make these appointments as soon as possible, so where can people do that?
So you can do that through carle.org. Make sure that you are flexible because we are trying to get all of our kids back into school and back into sports. So be flexible with what provider you are willing to see. The mobile clinic is also a great source of getting your physicals done and reaching out to family medicine as well.
Well, thank you both for joining me today and for all the great knowledge you've shared with our viewers. We really appreciate it. You heard it from them first. Head to Carle. We've got you guys connected to them online at ciliving.tv. Go make an appointment, get detected early, and it could save your life.